What is the recommended first drug to administer during adult cardiac arrest with ventricular fibrillation? A. Atropine. B. Amiodarone. C. Epinephrine. D. Lidocaine. Answer: C. Epinephrine 1 mg 4/IO is given every 3 to 5 minutes during cardiac arrest to improve coronary perfusion. What is the correct compression to ventilation ratio for adults in 2 rescuer CPR? A. 15:2. B. 30:2. C. 5:1. D. 20:2. Answer: B. In adult CPR, the compression to ventilation ratio remains 30:2 for both 1 rescuer and 2 rescuer CPR. Which rhythm is considered shockable in ACLS? A. Pulseless electrical activity. B. Asystole. C. Ventricular fibrillation. D. Sinus bradycardia. Answer: C. Ventricular fibrillation is a shockable rhythm and should be treated with defibrillation. What is the correct dose of amiodarone during cardiac arrest? A. 150 mg every 5 minutes. B. 300 mg 4/IO bolus, then 150 mg. C. 1 mg per kilogram for every 10 minutes. D. 900 mg infusion. Answer: B. Administer 300 mg 4/IO push first, followed by 150 mg if needed. What is the preferred route of medication administration during cardiac arrest? A. Oral. B. Intramuscular. C. Intravenous or intraosseous. D. Subcutaneous. Answer: C. 4 or IO access is preferred for rapid drug delivery during resuscitation. Which of the following is a reversible cause of cardiac arrest, H's and T's? A. Hyperkalemia. B. Hypoglycemia. C. Hypothyroidism. D. Hypertension. Answer: A. Hyperkalemia is one of the H's in the reversible causes of cardiac arrest. What is the initial shock dose for biphasic defibrillation in adults? A. 50 joules. B. 100 joules. C. 120 to 200 joules. D. 360 joules. Answer: C. Initial biphasic defibrillation dose ranges from 120 to 200 joules depending on the manufacturer. After ROSC, what is the target oxygen saturation? A. 70 to 80%. B. 80 to 90%. C. 92 to 98%. D. 100%. Answer: C. Maintain SpO2 between 92 to 98% to avoid hyperoxia. Which drug is used to treat bradycardia with a pulse? A. Epinephrine. B. Atropine. C. Lidocaine. D. Amiodarone. Answer: B. Atropine is first-line therapy for symptomatic bradycardia. When should you initiate post-cardiac arrest care? A. After 10 minutes of CPR. B. After ROSC. C. After administering 2 shocks. D. Immediately on arrival to hospital. Answer: B. Post-cardiac arrest care begins as soon as return of spontaneous circulation, ROSC, is achieved. Which is the correct ventilation rate during CPR with an advanced airway? A. 1 breath every 3 seconds. B. 10 breaths per minute. C. 5 breaths per minute. D. 1 breath every 2 seconds. Answer: B. Once an advanced airway is in place, give 1 breath every 6 seconds, 10 breaths per minute. Which rhythm requires synchronized cardioversion? A. Ventricular fibrillation. B. Sinus tachycardia. C. Unstable supraventricular tachycardia. D. Asystole. Answer: C. Unstable SVT with a pulse requires synchronized cardioversion to avoid R-on-T phenomenon. What is the best way to confirm ET tube placement? A. Chest rise. B. Auscultation. C. Capnography. D. Fogging in tube. Answer: C. Continuous waveform capnography is the most reliable method to confirm ET tube placement. What is the appropriate action when a patient is in pulseless electrical activity, PA? A. Immediate defibrillation. B. Administer amiodarone. C. Begin CPR and give epinephrine. D. Give atropine. Answer: C. PA is not shockable. Initiate high-quality CPR and give epinephrine every 3 to 5 minutes. What is the first priority in managing a patient with suspected stroke? A. Give aspirin. B. Provide 4 fluids. C. Check blood glucose and activate stroke team. D. Administer oxygen. Answer: C. Time is brain. Confirm blood glucose to rule out hypoglycemia and activate the stroke team. When should CPR be paused to check rhythm or pulse? A. Every 1 minute. B. Every 2 minutes. C. After 10 compressions. D. After every shock. Answer: B. Rhythm and pulse checks should occur every 2 minutes, ideally under 10 seconds. What rhythm is described as chaotic, disorganized, and without a pulse? A. Asystole. B. SVT. C. Ventricular fibrillation. D. Sinus rhythm. Answer: C. VF is chaotic, disorganized electrical activity with no effective heartbeat. What is the compression depth for adults during CPR? A. 1 inch. B. 2 to 2.4 inches. C. 3 inches. D. 1.5 inches. Answer: B. Adult compressions should be at least 2 inches deep but no more than 2.4 inches. When is transcutaneous pacing indicated? A. Asystole. B. Symptomatic bradycardia unresponsive to atropine. C. Tachycardia. D. VF. Answer: B. Transcutaneous pacing is used for symptomatic bradycardia not responding to atropine. What does ROSC stand for? A. Return of sinus conduction. B. Respiratory output and cerebral perfusion. C. Return of spontaneous circulation. D. Rhythmic onset of cardiac contraction. Answer: C. ROSC stands for return of spontaneous circulation, indicating that the heart is beating effectively again. When is lidocaine an appropriate alternative to amiodarone? A. In SVT. B. In refractory VF/pulseless VT if amiodarone is unavailable. C. For bradycardia. D. For PA. Answer: B. Lidocaine can be used when amiodarone is not available for shock-refractory VF/private. What is the adult dose of atropine for symptomatic bradycardia? A. 1 mg every 3 minutes. B. 0.5 mg every 3 to 5 minutes up to 3 mg. C. 2 mg every 10 minutes. D. 0.25 mg every 5 minutes. Answer: B. Give 0.5 mg for every 3 to 5 minutes, with a maximum total dose of 3 mg. What is the correct BLS sequence for unresponsive, pulseless adult? A. Airway, breathing, circulation. B. compressions, airway, breathing. C. Breathing, airway, circulation. D. Circulation, airway, defibrillation. Answer B. The correct sequence is CAB, compressions, airway, breathing. What is the next step after delivering a shock for VF? A. Reassess pulse. B. Resume CPR immediately. C. Give epinephrine. D. Administer amiodarone. Answer B. After a shock, resume CPR immediately for 2 minutes before rechecking rhythm or pulse. What is the dose of epinephrine in anaphylaxis? A. 0.1 mg 4. B. 1 mg 4. C. 0.3 mg IM. D. 0.5 mg 4. Answer C. For anaphylaxis, give 0.3 mg intramuscularly, IM, in the mid-outer thigh. What is the primary goal of ACLS and cardiac arrest? A. Administer medications quickly. B. Intubate early. C. Optimize high-quality CPR and early defibrillation. D. Apply ice packs. Answer C. The most effective interventions are high-quality CPR and early defibrillation. What is the most common cause of PA? A. Tension pneumothorax. B. SVT. C. Hypovolemia. D. STEMI. Answer C. Hypovolemia is a common reversible cause of pulseless electrical activity. What is the most appropriate treatment for unstable tachycardia with a wide QRS? A. Immediate defibrillation. B. Amiodarone infusion. C. Synchronized cardioversion. D. Lidocaine bolus. Answer C. Unstable tachycardia, regardless of QRS width, requires synchronized cardioversion. In ACLS, when can you administer magnesium sulfate? A. In bradycardia. B. In PA. C. In torsades de pointes. D. In asystole. Answer C. Magnesium sulfate is used for torsades de pointes, a polymorphic ventricular tachycardia. What should you do immediately after noticing a patient is unresponsive with no breathing and no pulse? A. Give 2 breaths. B. Start chest compressions. C. Apply oxygen. D. Place 4-line. Answer B. If no pulse and no breathing are detected, begin CPR with chest compressions immediately.